Hey guys, Nishan. We're just going to continue on the series of videos that I've been recording about the COVID pandemic and how it has affected all of our lives. As you know, I'm an emergency room physician, so as an ER doctor, like my last video had stated, we are truly scared about potential exposure to this infection. So I'm just going to demonstrate what we would have done before the whole pandemic and what we are doing now to protect ourselves. So before, say a patient comes in, really sick patient, not breathing well, and we're gonna put a breathing tube down her throat. This is the process called intubation. What we would do is, we would paralyze her first. We would put this mask on her face and bag the air into her lungs so she's getting enough oxygenation. With this process, we'll try to make sure that her oxygen level is up to 100%. So that gives us a little bit of a reserve for her lung capacity. And we will stop bagging, take one of our blades here. This is a video laryngoscopy that we would do. Put it in her mouth, look at the vocal cords, and insert a tube down her throat. As you could understand, this is a very high risk procedure for exposure to the respiratory droplets and the virus that lives within the lungs of the patient. What we've done now, thanks to my wonderful neighbor, Christy, who helped me develop this and actually develop this intubation box for the department to prevent the exposure to the physicians and the nursing staff in a COVID positive patient. So she's a COVID positive patient now, and before we would not have, this is all the supplies that we would have used. Now, when the COVID positive patient comes in, we use full personal protective equipment, meaning N95 mask, eye protection, hair protection, and a full gown. A lot of us here are using the painter's respirator masks, which are even stronger than the N95 masks, just so we can avoid that inhalation of the virus. So I would be fully draped, which obviously I'm not right now, and we would call for the intubation box right here. We would put the patient down, and she would have nasal cannula and a ventilation mask that would be giving her passive oxygenation. We also would have this, as you can look at this intubation box, it's closed on three sides. There are two ports here, which are 5 by 8 inches in dimensions, are used for me to put my hands in there so that I can get access to her mouth and her trachea. There's a port here to put devices like the suction catheter, which would be used in case she has excessive oral secretions that are coming out of her trachea, and we would have this tube inside as well. So now, when the patient comes in, we put these intubation box over them to protect all of the providers in the department. Additionally, we will have a drape that would extend from here downward. So if there's any aerosolized particles that are going to come out of here, they will be captured within the drape. That says we're still using all of the personal protective equipment to to protect ourselves, because there always is a risk for catching this bad disease. So with this, if you could just give me the slide scope one more time. This wire goes in here. And now I have the video laryngoscope inside the box. I can put it in her mouth, take a look at everything that's happening in the camera. I guess right now the camera is not working since I unplugged it. And using the video laryngoscopy, I would take this, this tube and easily insert it in. Another thing is we've left the ports for the arms large enough so that if I need and I'm unsuccessful with this video laryngoscopy, I can actually go directly with my hand doing the old school intubation technique with just the DL or direct laryngoscopy, where I'm visualizing the vocal cords with my eyes instead of using any kind of an assist device and place it in. So here you have it, just a little demonstration of how the practice of medicine is changing because of this pandemic. And this is just an introduction to this intubation box, which my wonderful neighbor created for us. And a lot of the physicians, anesthesiologists, and ER doctors are taking their own precautions and making this to help kind of save themselves and also the nursing staff. Again, I want to thank my wonderful nursing staff here that's helping me put this demonstration together. And I think that's it. So until next time.